So I would say, I mean, probably bright is not exactly the correct word, but I think that there is additional hope for these patients. So patients with relapsed refractory large B-cell lymphoma for many years have had not so many treatment options, and most of the treatment options were not considered curatives, and probably this is more true for the elderly population of patients that have never been able to tolerate so well maybe intensive chemotherapy, which was the standard of care for those young patients that relapse after first-line treatment strategies. So I think that nowadays we have treatment options that are really effective for the elderly population of patients, that have been specifically tested in this population of patients, because sometimes not all trials are including the elderly population of patients, so we really don't know what happens in them, and that bring, let's say, effective therapy for them. So even with a curative intent, so we have been talking about axi-cel and the potential use in this elderly population of patients. I think that with the data that it's being reported in the subgroup analysis of the ZUMA-7, we can say that some patients can be cured. A significant proportion of them can be cured with CAR-T in second line. So I think that the future is much better now than it was several years ago.